Total hip replacement is a big surgery. It's a procedure that can significantly improve the quality of life for those suffering from severe hip pain and mobility issues. This surgery is often recommended when other treatments, such as medications and physical therapy, have not provided sufficient relief. The goal is to replace the damaged parts of the hip joint with artificial components, allowing for smoother and pain-free movement. It's also a common one. Thousands of people undergo this procedure every year, making it one of the most frequently performed orthopedic surgeries. The success rate is high, and many patients report significant improvements in their ability to perform daily activities. It helps people with hip pain live better lives. By alleviating pain and restoring function, total hip replacement can enable individuals to return to activities they enjoy, such as walking, gardening, and even light sports. The recovery process involves a combination of rest, physical therapy, and gradual return to normal activities. In this surgery, the doctor replaces your hip joint. The procedure typically involves making an incision over the hip, removing the damaged bone and cartilage, and then inserting the new artificial joint components. These components are designed to mimic the natural movement of the hip joint. The hip joint is like a ball and socket. The ball, or femoral head, fits into the socket, or acetabulum, allowing for a wide range of motion. This design is what enables us to move our legs in various directions. The ball is at the top of your thigh bone. This part of the joint is crucial for bearing weight and allowing for smooth movement. When it becomes damaged due to arthritis or injury, it can cause significant pain and mobility issues. The socket is in your pelvis. This part of the joint holds the ball in place and allows for the rotational movement of the hip. Damage to the socket can also contribute to pain and reduced mobility. During surgery, the doctor removes the damaged bone. This step is essential to ensure that the new artificial components can be securely placed and function properly. The removal process involves careful precision to avoid damaging surrounding tissues. They replace it with artificial parts. These prosthetic components are designed to replicate the natural structure and function of the hip joint. They are typically made from durable materials that can withstand the stresses of daily activities. These parts are made of metal, plastic, or ceramic. Each material has its own advantages, and the choice of material can depend on various factors, including the patient's age, activity level, and the surgeon's preference. After surgery, you can walk and move with less pain. The recovery period is crucial for the success of the surgery. Patients are usually encouraged to start moving and walking with assistance soon after the procedure to promote healing and prevent complications. You'll need time to recover and do exercises. Physical therapy plays a vital role in the recovery process, helping to strengthen the muscles around the hip and improve flexibility. Following the prescribed exercise regimen can significantly enhance the outcome of the surgery. But most people feel much better after this surgery. The majority of patients experience a substantial reduction in pain and an improvement in their overall quality of life. With proper care and rehabilitation, they can return to their normal activities and enjoy a more active and fulfilling life. Many things can damage your hip joint. Your hip is a complex structure that bears a lot of weight and stress every day. Over time, this can lead to wear and tear, making it susceptible to various conditions. The most common is arthritis. Arthritis is a broad term that encompasses over 100 different types of joint pain and joint disease. It affects people of all ages, genders, and ethnic backgrounds. Arthritis makes your joints stiff and painful. This stiffness can make it difficult to perform everyday activities such as walking, climbing stairs, or even sitting down and standing up. Osteoarthritis is a type of arthritis. It is the most common form and is often referred to as wear and tear arthritis because it occurs when the protective cartilage that cushions the ends of your bones wears down over time. It happens when the cartilage in your hip wears down. Without this cartilage, your bones rub against each other, causing pain, swelling, and reduced motion in your hip joint. Cartilage is the cushion between your bones. It allows your joints to move smoothly and absorb shock. When it deteriorates, the resulting friction can lead to significant discomfort and mobility issues. Rheumatoid arthritis is another type. Unlike osteoarthritis, which is caused by wear and tear, rheumatoid arthritis is an autoimmune disorder. It's a disease where your body attacks its own joints. This immune response causes inflammation that can damage the hip joint and other parts of the body. This can also damage your hip. The chronic inflammation associated with rheumatoid arthritis can lead to the destruction of cartilage and bone within the joint. Other conditions can also lead to hip replacement. These include traumatic injuries, congenital deformities, and other diseases that affect the bones and joints. These include injuries, bone tumors, and bone diseases. Severe trauma from accidents or falls can fracture the hip, while bone tumors and diseases like osteoporosis can weaken the hip joint. If your hip pain is severe and limits your daily life, you might need a new hip. Hip replacement surgery can significantly improve your quality of life by reducing pain and restoring function to your hip joint. Before surgery, you'll get anesthesia. This means you'll be asleep and feel no pain. The surgeon will make a cut near your hip. They'll remove the damaged bone and cartilage from your hip joint, then they'll attach the new artificial parts. The new ball fits into the new socket just like your natural hip. The surgeon will close the incision with stitches or staples. You'll have a bandage over the area. The whole surgery takes about 1 to 2 hours. Section 4. Risks to consider. It's not always smooth sailing. Like any surgery, hip replacement has some risks. Infection is one risk. Blood clots are another. These complications, although rare, can be serious and require immediate medical attention. It's crucial to follow your surgeon's advice to minimize these risks. You might also have some pain, swelling, and stiffness after surgery. These symptoms are part of the body's natural healing process. Pain management strategies, including medications and physical therapy, can help alleviate these discomforts. Swelling can be reduced by keeping the leg elevated and applying ice packs as recommended by your healthcare provider. These are normal and usually go away with time. Physical therapy plays a vital role in your recovery, helping to restore strength and mobility in your hip. It's important to stay committed to your rehabilitation program to achieve the best possible outcome. In rare cases, the artificial hip can dislocate. This can happen if the new joint is subjected to certain movements or positions that put too much stress on it. This means the ball comes out of the socket. If this occurs, it can be quite painful and may require another surgery to correct. Understanding the proper ways to move and the positions to avoid can significantly reduce the risk of dislocation. You'll need to be careful with certain movements after surgery to prevent this. Your physical therapist will guide you through exercises and movements that are safe and beneficial for your recovery. It's important to talk to your doctor about the risks. Open communication with your healthcare team ensures that you are well informed and prepared for the recovery process. They can tell you if hip replacement is right for you. By understanding the potential risks and benefits, you can make an informed decision about your health and well-being. Section 5. Bouncing back. Your recovery journey begins. After surgery, you'll wake up in the recovery room. Nurses will monitor your vital signs. You'll likely stay in the hospital for a few days. You'll start moving your new hip soon after surgery. This helps prevent stiffness and blood clots. At first, a physical therapist will help you. You'll learn exercises to strengthen your hip. You'll also learn how to walk with a walker or crutches. You'll gradually do more on your own as you heal. Section 6. Get moving. Physiotherapy and exercises. Physiotherapy is very important after hip replacement. It helps you regain strength and movement in your hip. A physiotherapist will teach you specific exercises. These exercises help you move your hip in all directions. They also strengthen the muscles around your hip. You'll need to do these exercises regularly at home. Your therapist will tell you how often and how long to do them. Following their instructions carefully is important for a good recovery. Section 7. Your new hip, your new life. Total hip replacement can greatly improve your life. It can relieve pain, improve mobility, and help you do the things you love. You'll be able to walk, climb stairs, and even dance with less pain. It's important to follow your doctor's advice for a successful recovery. Make sure to attend all your physiotherapy appointments. Do your exercises regularly. Take your medications as prescribed. With time and effort, you can enjoy a more active and fulfilling life after hip replacement.